Hello, West Michigan. You are watching Alive and Well. I'm Linda Balkema, and we are here at the Mercy Health Comprehensive Breast Center. And with me is Kelly Jensen, and Kelly's going to tell us all about this wonderful facility here. It is Breast Cancer Awareness Month, so we really want to focus on the issues of breast cancer, but breast health. So Kelly, tell me all about what you do here, and what is your title?
Well, thank you. My name is Kelly Jensen, and I am the high-risk coordinator, but I'm also a medically trained physician assistant here at the Breast Center. And we offer a lot of services to the individuals of Muskegon and our surrounding counties. We offer Mammo Plus, which is a mammogram, plus risk assessment. And what that is it's a screening questionnaire where an individual answers about 7 questions about their personal and family history, and those 7 questions then help us determine if they're at elevated risk for being diagnosed or for having breast cancer.
Okay, so 7 questions, that's all it takes to find out if they're at an elevated risk. Can you tell me, you probably know those 7 questions by heart, so tell me what those questions are.
I do. The questions, well, first of all, it's a screen. Okay. So it's not really going to tell us in absolutely who's at elevated risk, but it opens the door to give us an idea of who may need to be screened in more detail. So those 7 questions are: how old were you when you had your first child? How old you were when you had your first period? How many first-degree relatives, which would be a mom, a sister, or a daughter with breast cancer? If you've ever had a breast biopsy yourself, if so, how many? And were they atypical? Not necessarily a cancer, but were they abnormal, but benign abnormal?
Okay, so that brings to question a lot of things. Family history, of course, is very strong when it comes to determining if you're at risk. Some of us, myself, I don't know my family history, so that's always been a concern. It's kind of scary. So when you have people that don't know their family history, I was adopted and never knew that history, but you look at those other questions. For instance, how old were you when you started your period? So if you started younger, is that a concern?
Correct. Individuals, and I always I don't want to say feel sorry, but for those unfortunate young ladies who start before the age of 12, it is an independent risk factor that slightly increases their risk. The same can be said for when they have their first child. For individuals who have their first child after the age of 30, or who decide never to have children, that increases their risk slightly as well.
Okay, so it's all part of the hormone balance and everything else. So, and I do understand that a lot of young ladies today are starting their menstrual cycles at a younger and younger age, and that's another diet concern, another talk we could have at another time. Okay, so once you determine this risk, then what is the next step?
Well, when they come through the Mammo Plus program, and if they have been identified as having, our threshold is 20%. So if they have been identified as having over 20% risk, what we do is we send a letter to their primary care provider or whoever is associated with their medical care, letting them know that, so they're in the loop. Their primary care provider then can decide, or their gynecologist, whomever they see, can decide if they want to send them for a more detailed, more thorough risk assessment. And it's at that point that the Risk Plus clinic gets involved, and we reach out to the patient to bring them back in for a more detailed risk survey and risk assessment.
Okay. Well, when you talk about the Risk Plus, that's always scary when you hear these words, and I think any woman facing that, having an abnormal mammogram or anything like that, when you find out just the idea of where we always call it the big C and the fear of cancer, I think what's really important for our viewers to understand is that now, because there is so much ability to identify this in the early stages, or to do such surgeons, they've advanced so much with what they can do. Mm-hmm. But if you get to the point of Risk Plus, that doesn't necessarily mean it's cancer. Is that correct?
Absolutely not. It's being proactive with your health rather than being reactive when you get a diagnosis. It's trying to take the information that we know today and create a proactive screening pattern or plan for that patient based on her risk. Instead of the fact that she's a female, we want to tailor that risk screen to who she is and all of those factors that make her who she is.
Okay. So I know it's there's also some controversy about how often a mammogram is needed. Some advocate yearly, and some say that biannual, or that's every 2 years is fine too. Is it based on your risk factors?
Well, risk does And how your level of risk indicates when you should begin screening, because an average risk woman should start screening mammograms at age 40. And that's per the American Cancer Society and the American College of Obstetrics and Gynecologists, as well as other American College of Radiology. There are very many bodies that recommend screening starting at age 40 and annually thereafter. Now, individuals who are at elevated risk may need to be screened earlier than that. And not just with mammogram, we have other screening interventions that we may recommend after they come through and their true level of risk is determined.
Okay, well that's good to know. And what about self-exam? That's something else that I've heard has changed over the years. I used to recommend a monthly self-breast exam, and I don't know what age you should begin that at, truthfully, but do they still recommend that? And if so, how often and at what age?
Well, the paradigm has shifted. Rather than having this discrete self-breast exam on a monthly basis, the recommendation is more now toward breast awareness, self-awareness, because the thought is to know you're normal. And we've heard that term many times, know what your normal breast tissue is supposed to feel like. Because then if there is a change, you would be the first to notice it. Because most women will tell you, all I feel are lumps and bumps. And that is really, truly a normal for most women. And so knowing that about themselves is what's recommended, so they could tell us if there's something new or abnormal.
Abnormal. And I think a lot of women, when they first discover a lump or bump, I've heard several say that they find maybe a lump under their arm when they're taking a shower. A lot of times they discover this in the shower. Otherwise, they're not so conscious. Although now with all of the media on it, I think there's, remind your friend and all of those things. And I think it's very important that as women, we stick together and do become very aware of this. And I think we've all been affected or know somebody in our life or in our family that has been touched with breast cancer, lost friends to breast cancer. So, yes, it is very important. Okay, so beautiful facility here. Yes. And there's different areas that do different things. We talked about you do the risk management, and then after you, it goes if there's something discovered.
Well, there's different ways to kind of enter our facility. Most women will come through and have a routine mammogram, and that routine mammogram will end in a letter that goes back to you and your physician saying, okay, things are good, we'll see you in a year. That's the most common finding. Every now and again, when they do some images, they may not notice, they may notice that there's been a change, or they may not get enough information via the pictures that they're able to comfortably give you an all clear for next year. So some women will get called back for what they call compression views for mammogram, or perhaps an ultrasound to look at the tissue. Those aren't necessarily bad things. As a matter of fact, most of the time those turn out to be normal. If, for whatever reason, that those areas look suspicious upon that further imaging, often what can happen is we have a program called Rapid Results. And what that means is on the day that they're here for their imaging, whether that be mammogram or ultrasound, if we have availability, and most often we leave availability in our schedule, we can offer a biopsy when it's indicated the very same day. And what that does is it just compresses the time of worry down as much as we can possibly do. And then if that biopsy is offered, we've also partnered with our Pathology Department. Those are the physicians who read all of our studies, the tissue that's removed. They have partnered with us, and they are supporting getting those results back to us. Sometimes within one business day, but we usually say no longer than 2 business days. That's their goal.
That is so wonderful, because I know in days past, years ago, that people would get this, and then of course, you get the scare, I've got to go back for a second test. You already have that in your mind. And then to think that you have to have a biopsy, you used to have to wait for the biopsy. And then if it was a Thursday or Friday, you'd agonize all weekend waiting for Monday to find out. And now the rapid results, you can get that. And I do know a friend just 2 months ago, she had rapid results, and she was very happy about how everything, she did have to have, she elected to have a double mastectomy, and it turned out to be the best thing for her, but she also had a family history. And so she's very much so an advocate of, do your annual exams, make sure you get your mammograms every year. And they found, just from last year, it was normal. This year, that quick, they'd found it, did the biopsy, and she had her surgery within 2 weeks.
Yeah, and had she not been getting her annual mammograms, think of how much longer that would have lapsed.
Exactly, and how much that cancer would have had a chance to grow. So, so important to be aware of this. Okay, is there any more you want to tell me about the overall, or are we going to go on to the next step?
Well, I just want to make sure we know we have Mammo Plus, which is what all women will experience when they come through the system. It's a mammogram plus their risk assessment, risk questionnaire. We have rapid results, which are if they're in the phase of needing a biopsy, the goal would be to bring those results back to the patient ASAP. We have Risk Plus, which is when I do a more detailed risk assessment. Often with Risk Plus, I will do management recommendations. So if the women are at elevated risk, we may recommend MRI screening of the breast, or we may recommend something called chemo prevention, which isn't chemotherapy, it's medicine to reduce breast cancer risk. Or we'll do breast exams more frequently. And sometimes that even leads to genetic education, genetic discussion, and genetic testing, which we offer here on site. If a woman is unfortunate, and I shouldn't say it like that, because our goal is early diagnosis, early detection, catching that cancer as early as possible. So when that does happen, when a woman does have to have a biopsy here at the center, they're in contact with our nurse navigator, Mary Miller, and she takes over the role of what we call Navigation Plus. Okay. So she is the point person from point A, which is when she's even considering a diagnosis or considering a biopsy, all the way through her diagnosis and treatment. She is your point person, your individual who manages all care and who just keeps everything flowing and keeps everything together. And I would like Mary to talk about what she does here too.
Okay, good. And we are going to interview Mary Miller so she can walk us through that process. Well, thank you so much. It's been a pleasure, and I love the facility here, and I'm glad that you're here to bring this awareness and to help our community.
Thank you. Thanks for having me.
The best way to stay healthy? Exercise your voice. At the new Mercy Health, we believe that carefully listening to you and encouraging you to take an active role in your own health care is an important part of keeping you healthy. So you'll find our extensive network of physicians not only use the latest technology, they focus on what you have to say. Your voice, our expertise. Mercy Health.
Roll, tumble, jump, and dance with the stars here at Castle Dance and Gymnastics. From 16 months to adults, Castle offers a safe and friendly atmosphere. Located at 1180 Devon Drive, their number is 231-798-8418. Or find them at castlegymdance.com.
Getting this family together is like herding cats.
Simplifying things for families is a priority here at Grange Insurance. We offer a variety of policies through Grange Independent Agent.
Your partner in protection.
The Coby Jack Pub Burger is a bold twist on our butter burger. We're really excited about this burger. Our new pub burger features gourmet real Wisconsin cheese.
Coby Jack has blended two cheeses, Colby cheese and Monterey Jack. This cheese was first created in Arena, Wisconsin, just down the road from your place.
Do you know how big Arena is? Not very big.
Coby Jack is a mild cheese, and it has just the right amount of melt.
That is good.
I think it's a perfect fit for this burger.
Seared Midwest beef, always fresh. It's got crispy onions on it. It's got steak sauce, 4 peppercorn mayo. We top it with your Coby Jack cheese. So the cheese really complements all the ingredients in this burger.
Yes.
What really tops off our pub burger is this beautiful artisan bun. From the burger to the bun, it's one layer of flavor after another. Welcome to Delicious.
Hello, West Michigan. You are watching Alive and Well. I'm Linda Balkema, and we are here at the Mercy Health Comprehensive Breast Center out at the lakes. In fact, with me is Mary Miller. And Mary, you can tell me all about you, but I want you to tell our viewers where this location is because we haven't covered that yet. How do people get here?
We are located at the Lakes Village on Harvey Street, which is down from the mall towards Panaluna. You can either come from 31 to Panaluna or take 31 to Sternberg exit and then take Harvey down. We're next to the Sitzma Funeral Home on the same side as them down from the mall.
Thank you. Well done. I think that's pretty important for our viewers to know. Okay, so Mary Miller, what is it you do and what is, I know you're an RN, but you have other titles here as far as navigation and just what does that mean?
I am the nurse navigator for breast cancer. So I have my bachelor's degree in nursing, then also got licensed in breast cancer navigation for imaging and cancer. And what I do is I'm the first point person for a patient if they're coming in and we see something suspicious, and then they are recommended a biopsy. So I meet them at that time, so they have a familiar face, somebody that they know and can relate to. And then when they have their biopsy, as Kelly had talked to, we do the rapid results program. Those results then from the pathologist are called to us, and they come to me if they're positive. So if they do have a positive breast cancer diagnosis. So
I bet you become a lot of, not only women, we discussed this too off camera, men too, but you become their best friend in many ways. I bet you follow their case all the way through, so they have that comfort and that knowledge of somebody that is there with them.
Yep. Prior to having a navigation program, the patients would be notified by their primary care physician, you have breast cancer, you need to see a surgeon. It was kind of up to them to know what to do. They didn't have the education. They were scared. And now what happens is when the results come to me, I work together with the primary care physician. Either the primary care physician notifies them of their diagnosis or they tell me to. And then I make the referrals to the needed surgeon and then follow them through surgery, do their education for surgery, do their post-op education, and then help them through the next phases, which can be chemotherapy or radiation or hormone therapy or physical therapy. So I'm there to help navigate through those things so there's a less of a time in between each step. So they feel like they're not lost in the shuffle and there's not delays in getting information between the offices and back and forth. And that sort
So that navigation is important to go from between the doctor's office and the patient. And so sometimes you are asked to deliver the news, so to speak. You are the one that actually tells them of their diagnosis.
There are some providers, some primary care providers that have kind of signed off knowing that that's our expertise here and that's our forte, and know we're educated and they feel comfortable with us providing the patients with those diagnoses. And I meet them at the time of their biopsy, so there is a little bit of a connection there. And so that helps too.
I can tell just in talking to you that she just has this warm, wonderful feeling. You're one of those people that's blessed with that. That's most likely why you're in the field you're in. And I think a woman would feel very comfortable talking to you and that you're very good at that. So that's why you do what you do, and you're experienced at it.
Calling.
It's a calling.
Yeah,
I
believe it is also, yeah.
Yeah, and it's I imagine for every woman they take that news differently, but it's even though you hear it and you think about it, and I think every woman has had that cross her mind. It's a fear that we all live with. It's the advances has also made us so knowledgeable about it. We hear about it everywhere we go. We know so many people. Social media has made it so we're more aware of more people that has been affected by this, which brings me to wonder, is there truly an increase in breast cancer, or is it just that we're so aware now that we know more people that have it? Has it increased?
I think it has increased. We are seeing more of it, and we don't really know why, if it's environmental, if what it is, but there definitely has been an increase. And we're catching them earlier too. Right. Oftentimes, especially years ago, your grandmother would have died of cancer, but they didn't even know where it started. Sure. Where now we identify it very early on, and we know when we catch it early, it can be cured.
And I think breast cancer is one of the cancers that are probably the most, along with being early detectable, that it's more localized, and if it's caught early, people go on to have long, healthy lives.
Yes, that's right. And one of the things, we really push women coming out and getting a mammogram and having screening done. Don't delay. When you turn 40 years old, they want you to have it every year, unless you have a risk. I don't know if Kelly alluded to that. If you have a history of first-degree relative, then they want you to start 10 years prior to whatever age they were diagnosed with your screening. And there should be no barriers in coming in to getting a mammogram. For people who don't have insurance, or people who have insurance but are underinsured, or they are afraid they can't meet the copay, we have funds, we have grants, we have means to cover them. So they do not need to fear that or not become because of a financial restraint.
That's very important. So if you are underinsured or uninsured, do not be afraid to call. Come in here, get that breast screening done. It's so important to have that done, starting at the age of 40, or if you feel you have other high risk factors. In fact, if you're a young woman and you feel something irregular and are afraid, go to your primary care, but don't be afraid to ask for a referral here, correct?
Yes, anytime you feel a palpable lump, you can call and we can get you scheduled. And if you do have a primary care physician, we can work with them getting an order. But to schedule a screening mammogram, you do not need to have a physician's order. You can call our center and schedule a mammogram. There does not need to be any order from your physician.
And we've got the number for that, correct? Yes.
The number is 231-724-7298.
Okay, and we will run that again later and have it across the bottom of the screen because it's so important that you have that number and call. I'm very glad that you mentioned you don't have to go to your primary care. So you can just come here for a screening without even going through your physician. That's great.
I wanted to brag about another thing that the Breast Center does here. We are triple accredited. I don't know if you had heard that. We have 3 different accrediting bodies that have, we've gone through painstaking measures to make sure we're meeting all these high standards and meeting metrics. And so part of the role of my role is to not only navigate the patients and be their advocate and their friend through their journey to survivorship, but also to make sure that each step of the way they're meeting the quality national standards. So for surgery, for timing, for chemotherapy treatments, for radiation, we have to input all that information, ensure that we're meeting the national standards so we are certain that we're giving quality care.
Quality care, and that's so important. I want to ask a little bit now, when you go through this process, we talked a little bit about chemotherapy. Sometimes, of course, that's needed longer and more often for depending on how serious the cancer is. Just give me an overview of that and going through what it's like when you go through this, or help your patients through that, because they're so afraid. The hair loss is huge for women. Yeah.
Unfortunately, first of all, not every woman who has breast cancer has to have chemotherapy. When caught early, you can avoid that. There's been a lot of research in breast cancer, and the chemotherapy agents have become very effective. They've really learned what agents you have to give to kill those cancer cells. So it's a lot to go through, but we know that there's promising research that shows it's effective. Unfortunately, with all chemotherapy for breast cancer, you lose your hair. And that's a hard thing. We do have resources here. We have actually the Creative Edge on Sherman is an American Cancer Society wig donor bank. You can go there and get free wigs. And you have to pay for your styling or servicing of the wigs, but they have a huge variety. And I hear great things about the ladies there. People really like them. And then also the Cancer Center, Johnson Family Care Center, has a program called Look Good, Feel Better for women to teach them how to manage wigs, tie scarves, stencil on eyebrows. They give them a $250 kit of makeup. And it's just a way of making them feel better and manage that loss of the hair loss.
It is. Yeah. Because in addition to potentially losing your breasts, which is also, the first thing, first is hearing about the cancer, and then losing your breasts, which we identify as women, as mothers, as, that's such an integral part of our femininity in our minds. But then there's reconstruction. Quite often now I understand they can do reconstruction right at the time they do the mastectomy.
They can begin reconstruction at the time of, oftentimes, not always, but most often they can begin at the time of surgery. And by law now, I don't know if all women know this, reconstruction has to be covered by your insurance. There's no insurance that can deny reconstruction. And even if you decide at the time of your cancer diagnosis you don't want to have reconstruction, 10 years down the road you decide, I'm ready now to do the reconstruction, you can go back and it will be covered by insurance. Yeah.
That's wonderful. I'm glad to know that's kind of a big kudos for women's rights, or insurance coverage. That's very important. So we've talked about the chemotherapy and the process and the diagnosis, and there's the Cancer Center. That's another, not just in this building, but there you have another building that people may go to.
We have the Johnson Family Care Center, which is located on Sherman in front of Mercy Hospital. That actually composes 2 different businesses. One is Cancer and Hematology of West Michigan. That part of the building does chemotherapy. They're the medical oncologists that are there, the wonderful nurses that do the infusions and staff. That's the chemotherapy, medical oncology side. The other side is the Jensen Family Care Center, which is radiation therapy, where we have radiation therapy and the radiation oncologists.
Okay, so if they're diagnosed here and they go through the process here, and then you help them, and then they would go for their treatments. If they require chemotherapy or radiation therapy, they go over to the Jensen Cancer Center, correct? Okay. And who are some of the doctors that are here on staff that?
We here at the Breast Center, we have dedicated 2 radiologists here every day that are doing the biopsies, reviewing the ultrasounds, reading the mammograms. Our director is Dr. Mark Haas. He's a passionate, wonderful, engaging doctor that really is superior and has really driven this comprehensive breast center to the high standard where it is. And then we have other dedicated breast surgeons that come here and will read and do the diagnostic procedures.
And you mentioned that sometimes you actually see those. Are you trained also to read breast cancer imaging?
I'm not trained like a radiologist. You get an idea of things.
Being around it
yeah.
so long that you connect. 'Cause
Yes.
to me, it all looks just like a blur, and I don't understand how they find, those little tiny lumps in there. But it's they're subtle. It's miraculous.
It's it does really take practice and a trained eye. And that's what's good about having a breast center, because those radiologists then are doing them consistently and, learning and being educated in that field and really becoming expert at what they do.
Okay.
So,
well, you certainly do cover all the bases here, and I really appreciate your time. Again, we want to mention this phone number. If you are underinsured or uninsured, please feel free to call 231-724-7298. If you're afraid, if you just want to be not even afraid, just please call. If you're over 40 and you feel that you need to have your screening done, it's time. Come in and do it. It's better to be safe than sorry. It's better to have that done and that, get that baseline done. Absolutely. That know you're normal. Okay.
Yeah, do know you're normal and come in and have the screening. We would love to see you, and it should not be a hassle.
Okay, Mary, and there's also some support groups in town. Is that correct?
That is correct. We have, just for breast cancer, we do have a support group. It's at the Jensen Family Cancer Center, which is located in front of Mercy Hospital there on Sherman. And it's a rather big support group. It's on the first Wednesday of every month from 10 to 12. And it's for people who are either going through treatment or who have already completed treatment but are still healing or just need to fellowship with people that have been through what they have. We share information and literature and stories, and it's just
and it's called Breast Friends. I like that. Breast Friends. Yeah. So those Breast Friends, again, they meet on Wednesdays?
Wednesday from 10 until 12, the first Wednesday of every month, so once a month. Yeah.
Well, good information to know. Another thing that we need to talk about a little bit is the diagnostic procedures. What can you tell me about that?
Well, when a patient comes in for a screening mammogram, or if they have felt a palpable lump and they're coming in, the first thing that usually we do is imaging. So they'll start out with a mammogram, which will oftentimes lead then to an ultrasound, which we'll do that same day. So if somebody comes in, let's say, and they're having a screening mammogram, and we see something that looks a little suspicious, we'll oftentimes right then offer them the diagnostic imaging of an ultrasound. And if that does also prove to be suspicious, our radiologists, which are on staff, will come in and review that with the patient. And if it indicates a biopsy, if it looks enough that we want to get a biopsy of whatever we're seeing, we can offer that to the patient right then. Most are agreeable and they want to do it right then. And some people, if it doesn't work, they will schedule it for the next day. But we offer that right then. That's our rapid results program. So right then we will do the biopsy. It's a core biopsy. It's non-invasive procedure. It's very simple, and they'll be in and out usually in an hour. And then those results, which typically in the past we used to take a week before you would get those results back. We worked with our pathologist to develop this program, the Rapid Results Program. So we'll get those back typically in 24 hours. And So then the patient comes in from screening to knowing what they have in a very shorter window.
Yes, and that's so important. It is so important to women that are waiting that time period. It's just a scary thing to think about, and then to think that you might have to wait days or a weekend or a week. It's nice that rapid results can happen now, you know.
And before there would be weeks in between each step. You'd have your mammogram, and then there'd be a week and you'd have an ultrasound. Then there'd be a week, and maybe you would go to a surgeon, then they would another week and you'd come here. Right. So now it's all in one place. And there have been a lot of studies that have shown that women, when they're waiting, have the same steroid level, the cortisol levels of stress, as they do when they've been told a positive diagnosis. Wow. So waiting can be just as stressful as knowing you have that positive diagnosis. So our goal was to try to, gear towards women and lower that window of stress time for them.
That's so great I can only imagine. I love the idea that you have rapid results, or that's available now.
And I said it was women.
I know. We want to talk about men, because men, it isn't.
Because men don't have much breast tissue, they're at a much lesser instance of having it, but they still are at risk. And we do have men that find lumps that come in, will have mammogram if they are at a genetic risk. Kelly, our high-risk coordinator, follows them. And we do see men here, and we've done biopsies of men here, and they just need to be aware if they find lumps or if they have a strong family history, they can connect with us as well and get the services.
Okay.
Yeah,
that is important. So men, you remind your wives, your girlfriends, your sisters, your mothers, but also check yourselves too, because it can affect you too. Okay, well, thank you so much, Mary. It's been a pleasure meeting you and talking to you, and I know you do a wonderful job with all these people that you work with. Thanks.
The Health Hut, located at 3112 Henry Street in Norton Shores, offers a full line of natural and organic groceries, including fresh produce and free-range, hormone-free meats, eggs, cheese, and dairy provided by local farms. Taking pride in carrying products which contain no preservatives, additives, or unhealthy fats, their wide selection of allergen-free foods can accommodate most specialty diets. From frozen desserts and entrees to pastas, baking mixes and cereals, to soups and salad dressings, to chips, candy, and other snacks. The Health Hut. We have your good health in mind.
With 4 convenient locations, Jack's Corner Store is one-stop shopping at its best. Tools, fresh meats, produce, chips, snacks, and other grocery items, beer, wine, and liquor, even gas and lottery. That's why Jack's is your corner store, and so much more.
For 13 years, Jewett Heating and Cooling has been providing the West Michigan area with fast professional service and installation. A paying dealer, they specialize in the service of all makes and models of furnaces and air conditioners, both residential and light commercial. With over 35 years of experience, Jewett is fully licensed with the EPA for lead removal. Jewett Heating and Cooling, your family-owned and operated heating and cooling specialist. 231-788-4287. Specializing in paint furnaces and air conditioning.
Whether you play recreational, travel, or high school soccer, Just for Kicks carries all the equipment and apparel you need. Soccer apparel such as cleats, shin guards, and headgear. Coaches equipment like cones, whistles, and training vests. Spirit wear like hoodies and t-shirts. A customer service-driven company, they work hard to ensure teams have everything needed for that first game so that the first-time soccer parents and players get started on the right foot. Just for Kicks offers embroidery and screen printing for clubs, schools, and businesses.
Whether you're a first-time jewelry browser looking for an extraordinary engagement ring, a couple celebrating your 60th anniversary, or you're just looking to treat yourself or mark an important event, Rothheim & Swanson Gemworks is proud to offer custom-made selections handcrafted in America. Silver, fine-colored gems, diamonds, and gold jewelry, as well as strands of lustrous quality pearls. From ring and watch appraisals to in-house jewelry design and repair, ring sizing, remounting, to a complete rebuilding, you can rely on them to keep your old favorites looking new. K&S Gemworks, Muskegon's community jeweler. Memories made one at a time.
Hello, West Michigan. You are watching Alive and Well. Welcome back. We are here at the Mercy Health Comprehensive Breast Center. And with me is Shelley Brassi. And Shelley, tell me about what you do here.
What we do here in the Patient and Family Resource Center, staffed entirely by volunteers, is provide a link for patients, their family members, and relevant, credible, accurate, interesting health information. Here at the Patient Family Resource Center, we have a lot of great takeaway material free of charge for patients on a wide array of topics ranging from general family health, cancer prevention, osteoporosis prevention, girls' health, boys' health, healthy cooking, healthy recipes, a little bit of everything, mental health issues, anything to begin the dialogue for people to think about their health, to think about what can I do, small changes, what can I learn that might make a difference in my health. We also have a wealth of information obviously related to breast health because we are within the Comprehensive Breast Center. We do also link with another patient and family resource center that we have out at the Johnson Family Cancer Center. And of course there, all of our information, or most of it, is geared toward the cancer patient, their families and caregivers, all across the cancer journey.
Oh, wonderful. You've done this a while, I think.
Yes. We opened both of our patient and family resource centers almost a year ago. And we're very pleased. We have an incredible group of volunteers. Everyone has a passion for information, a passion for making information easily accessible to patients and their family members so that maybe it's just one small part of their health journey, but maybe it's something that just triggers better conversation with their physician, with their team of healthcare providers. Maybe it helps them know how to ask a question.
Wow. So you're the lead volunteer. I can see why. Now, can you tell me a little bit about your background? Because you sound like an educator. Is that possible?
Well, I suppose yes and no in a very roundabout way. My background is actually human resources and risk management. But approximately 10 years ago, I actually deviated away from that a little bit and became intrigued by patient information and patient education, and had the wonderful opportunity for 8 years while my family and I resided in Ann Arbor to do exactly this within the Patient Education Resource Center at the University of Michigan's Comprehensive Cancer Center. So I learned from an incredible medical librarian how to make this work, and was fortunate enough to be able to be given the opportunity to do this here.
That is wonderful. So you come with a wonderful, I don't want to say pedigree, but a great background. Great background, U of M. That's wonderful. And so did you help facilitate some of this or give them any pointers on how to help set this up?
Yes. Basically, I started with a proposal for the two resource centers, for the one at the Cancer Center and here. What would it look like? What would it take to run it? How can we run it? What does the content need to be? Really, the way you start any project from ground zero right through to finishing.
So you initiated this whole project.
I did, with a lot of wonderful, wonderful support within Mercy. This is a venture that is extremely supported within the health system. We're very, very pleased and proud of that fact. The volunteers cannot be minimized. They are incredible. There are a total of 20 volunteers at this point in time supporting 2 centers. And they come from a wide variety of backgrounds, incredible backgrounds, some with healthcare, some not from healthcare, but all with a passion for connecting patients with information. That's really what we do. We are a face, a welcoming, comfortable point of entry to be able to obtain information in one space, not having to go to several different places to find information. We have books that can be checked out, just as if you were at a library on a wide range of topics, both here and at the Cancer Center's Resource Center. So many patients check out books. They want to explore a topic in detail, whether that's heart health for women or support and coping and caregiving across the cancer journey, or details about hormones and menopause and perimenopause and all of those
so many of
topics.
those issues. And in addition to all the books and the pamphlets and everything you have here that are pre-approved, you also have these 2 wonderful resources of the internet. And I imagine that you and your volunteers are trained to go to the appropriate sites, because what so often happens is that we tend to at home get on the internet and start diagnosing ourselves. And that self-diagnosis and reading from the wrong sites can really be detrimental. We don't want that to happen. So if they come here, they can get good information and guidance on the appropriate sites to go through.
Absolutely. Something that we also offer, both here and at our sister site, is an appropriately validated internet search. All of the volunteers are trained to search specific, appropriate sites to be able to assist a patient in searching for information for their question. We like to try to, again, make that process smooth, because we say, as you just did, when people go out on the internet, particularly if they're in a situation where they're maybe stressed because of a health condition or a recent diagnosis, it's like Alice going down the rabbit hole. Spinning out of control. I always say it's fun to Google 5,000 ways to make a spaghetti sauce. It's not fun to Google 5,000 things about, I just had a questionable mammogram. I need to come back for a biopsy. And the next thing you know, people are down what can be a very scary route that may have nothing to do with their particular situation and their particular biopsy.
I know, and I think it's so important, and people don't check their resources, because when you get on the internet, there are thousands, millions of people that are talking about different ways to take care of this health problem or granny's old, tale. And not to say that some of those don't work, but when you're diagnosed with something as serious and scary as breast cancer, you want to know your resources. You want to talk to the right people. You want to get to the best resources, and that's why we're so fortunate to have this Mercy Health Breast Center here, comprehensive breast center here in Muskegon. So, and to have all of your education and knowledge and the resources to help people finding out the correct information is very important.
We see our role at the end of the day as being a point where we can support the patient to support themselves in continuing their dialogue with their healthcare team. We link them with information so that they can discuss it further, or maybe the information is something as simple as healthy cooking recipes, which we have, that they just go off and say, oh, this is really nice. And again, all of the brochures that we have are complimentary. They do not cost the patient or their family member anything. They're all complimentary.
Okay, and can you just tell our viewers one more time where you're located and how they find us?
Sure. We are located within the Comprehensive Breast Center at the Lakes Village, and we are also located within the Johnson Family Cancer Center on Sherman Boulevard. And all you have to do is come in the front door of either location, and you will find the Patient and Family Resource Center.
And here they are located at the Lakes on the 2nd floor. So walk on up those beautiful stairs and come right in and see you.
Absolutely. Right? Please do. Please do, yes. And if you should happen to arrive and you don't see a volunteer, you can always take a piece of information, as many pieces that you may like that fit what you're looking for, and stop back and see us on another day when there is a volunteer in the center.
Hey, thank you so much. It's been a pleasure.
When your transmission is in trouble, it is important to find reliable and honest mechanics. National Transmission will get the job done right. Located at 4037 East Apple Avenue in Muskegon, you can call them at 231-788-3244.
Northway Lanes and Billiards, featuring Cosmic Bowling, 50 auto-score lanes, automated bumpers, 8 Brunswick pool tables, snack shop, and banquet facilities. With over 100 leagues to choose from, it's Northway Lanes and Billiards.
Hello, my name is Brett Wright. I own and operate Phoenix Crematory Services. Phoenix Crematory Services is located in Muskegon, Michigan, and we work with area funeral homes offering cremation services. We also are able to work directly with your family and their cremation needs. If you would like more information on the services that we have to offer, please contact us 231-733-5200 or go on our website www.muskegoncremation.com. Thank you.
The Pizza Ranch, featuring a buffet that is guaranteed to please even the pickiest eaters. From a full soup and salad bar, pizzas and breadsticks, to mouth-watering roasted chicken, potatoes and gravy, vegetables, drinks and desserts, all for just one price. Their menu features a wide variety of delectable favorites. You can dine in, carry out, or have your meals delivered. There's something for everyone at the Pizza Ranch.
24 hours, 7 days a week, it's Ramos to the rescue. For accidents, lockouts, jump starts, tire changes, or gas delivery, the experienced drivers at Ramos Towing will be at your side within a matter of minutes. Whether it's a motorcycle, medium duty, or a flatbed, whatever you need, just remember, it's Ramos to the rescue.
We are now at the Mastectomy Services at the Mercy Health Comprehensive Breast Center, and with me is Sarah.
Hi.
Hi, Sarah. Hi. Tell me, what is your title here?
I'm a certified mastectomy fitter.
Okay, wow. And to become a certified mastectomy, am I saying that correctly?
Mastectomy.
Mastectomy.
Yep.
I put an extra T. That's okay. So you, as a fitter, what do you do?
Well, after the women have gone through, usually they've all gone through the Comprehensive Breast Center and have been diagnosed, and once they are scheduled for whatever kind of surgery they're going to undergo, Mary Miller, our breast health nurse navigator, she usually gets them or gets me their information, and I'm able to contact them and have them come in to be pre-fit with some post-surgery garments that I would then deliver to the hospital after their surgery. And then once they are completely healed, which is usually 6 to 8 weeks down the road, also depending on, if they have to do any chemo or radiation, then they would come in and I would measure them and evaluate them for the breast prostheses and then the mastectomy bras.
Okay. And that's a very important part of the whole process, of course. After the mastectomy, I imagine a woman is feeling you're dealing with them in some very dire circumstances. It's a very scary thing that first time you see yourself after surgery, and you're there to help them through that process and to help fit them with some different prosthetics, or just the initial right after. If they haven't, sometimes they have stretchers put in. Is that correct?
The women that undergo reconstruction usually have those expanders put in right after surgery, so they'll have the general surgeon will do the actual mastectomy, and then the plastic surgeon would come in and then put the tissue expanders in.
And that is to stretch the skin so it can later have a prosthetic or something.
Yep, the implant
Implanted
then
in
inserted.
there.
Yep, so they stretch those, and then when they get to the point where they want to be, then they take the expander out, then they put in the implant.
Okay, so in the meantime, they're fitted with, show me some of the garments, or tell me about how this actually works.
Well, the majority of the patients that I see are women that don't have the reconstruction because they have nothing there. Right. So they would be fit with the external silicone breast prostheses that then fit in the mastectomy bras, which are a pocketed bra. They're pocketed on both sides, and these breast prostheses slide in and out of the pocket.
Okay.
And
so it gives them a natural look and a natural feel.
Yep, it's a really comfortable, easy way to help regain that body symmetry. And, women that have both breasts removed get to pick, how big or small they want to be.
Yeah, well, they might as well have a little bit of fun with it. And I know some women that have had a lot of fun with that. Sometimes they've lost their hair and they get to have a fun new hairstyle, and then they can be as big or as small as they'd like to be.
Yeah. And then, of course, when they just have the one breast done, then it's that remaining breast that helps guide us in which size and shape breast form we go with. Okay. So.
Okay, so you actually go in and you do the measurements, and you get into these have to then be ordered out and special made for each person, or?
No, I have quite a large inventory. Sometimes they come in and they leave with 3 bras in their prostheses, and I stock mostly neutral colors. I don't usually have the black, and I have a pink one over there, but you know, sometimes they want white or the special colors.
The beige is pretty. It's very lovely.
We typically have, but then, you know, if they want the others, then I would order them, and I have them the next week, so that's a very quick process as well. So,
and I think we'll get a shot of this, but I think it's very nice to note that these are very feminine, pretty bras. They're not all like sports bras. You could go that route, of course, but they compete with Victoria's Secret.
Definitely.
They do.
Yeah, that's a common misconception on mastectomy bras, that they're ugly and simplistic and, you know, plain. And
yeah, like this looks a little simplistic and kind of a sports bra, but
Yep.
that's okay. We have a lot of runners that like the sports bra.
This one's actually a post-surgery garment.
Oh,
this is one of the garments that I provide for them after their surgery. So you want to have something that's very simple and comfortable and easy to put on and take off. And so it's got your front hooks on it. These pouches are for the drainage management. They put their drain bulbs in these pouches, and they just Velcro in there because most women only have their drains for a week or so. And then they can just remove these pouches. And then these are also a pocketed garment that they come with these featherweight fiberfill puffs that can be inserted to help regain that silhouette while they're healing. And these are just featherweight. There's fiberfill inside because they can't have anything with any weight on that surgery site until they're completely healed.
Okay. And how long approximately did you say the healing process takes before they can get into the other bras?
Usually 6 to 8 weeks.
Okay.
I mean, I've seen some women at 5. They just want to be completely healed. No swelling, completely healed for hygiene purposes, you know, trying on things. And
drainage tubes out, and they do always after surgery have those drainage tubes.
Yeah, they usually only have them a week, sometimes 2 weeks, depending on how much drainage they're having.
Sure.
So,
prevent infection.
Yep.
Okay,
Yeah.
well, that's great that you do all of this. Is there anything else you'd like to share with our viewers?
Well, some of them probably don't realize that these are things that they can get whether they've had reconstruction. They make partials or shapers. This was a breast prosthesis that's going to replace an entire breast, but they do make products to help enhance the reconstructed breast, or if a woman has had lumpectomies.
Yeah, I know of women that have had lumps. So
they
just
do
a
make.
portion of their
Yep,
breast.
they make these partials or these shapers that go over that existing breast tissue to help fill the cup of a bra out and provide balance for any unevenness they may still have. And they are things that women's, you know, that their insurance will pay towards every year.
I was just going to ask, is this covered by insurance? So that's good to know. If somebody had a lumpectomy maybe 10 years ago and they want to come in here and get a prosthesis or something filled in.
Because a lot of times if they've had a lumpectomy and then they underwent radiation, you can get shrinkage, I guess. I mean, and then their natural breast is, you know, could be a cup or two larger than the other, and that's where that partial breast form really comes into play and can help even them up. So,
and what days and hours are you here to help people?
I am here Monday through Friday, 8:30 to 5.
Okay, good to know. Good to know. Right out here at the lakes, where you can just come up to the second floor, and you're just located a little ways down from the breast center, but comprehensive breast center, and there's it's a flow here. This building, it just has it all. It's, I hate to say one-stop shopping, but it is right here for you to kind of service all your needs. And so that's wonderful that we have Mercy Health here to provide us with this wonderful facility and makes women feel comfortable, and men. We found out that men are also affected by breast cancer. So, and thank you for what you do, Sarah.
Thank you.
Yeah. Thank you, Muskegon.
At Seaway Appliance, we're about great deals and great service.
And we stock everything from washers and dryers to the latest and high-definition TVs. And don't forget about our professional delivery and installation.
Here at Seaway Appliance, we have the Professional Service Department.
At Seaway Appliance on Henry Street in Muskegon.
Wanted cars, trucks, vans. Sprague's Auto Parts offers top prices for your wrecked, junk, or unwanted vehicles. Cash on the spot. We pick up or you drop off. For more information, call 231-726-2988. Sprague's Auto Parts, 81 South Getty Street, Muskegon. We buy cars for cash.
For nearly 9 years, West Michigan Driving Academy has been providing Muskegon County with complete, comprehensive driver's education. Students spend time both in the classroom and on the road in a state-approved driver's education vehicle with state-certified instructors. West Michigan Driving Academy is the only school in Muskegon that offers both day and evening classes throughout the summer. Accident-free with 150 years of combined experience, you will drive safe at West Michigan Driving Academy.
Now we are here at the Mercy Health Mastectomy Services, and I want to introduce Sarah. And Sarah, what is your last name?
Last name is Stir.
And Sarah, what is your role here?
I am a certified mastectomy fitter, and I work with the women that have undergone various types of breast surgeries, from the mastectomies to lumpectomies, and some do undergo reconstruction. And our relationship usually begins once they've gone through the Comprehensive Breast Center, and once they're scheduled for surgery, Mary Miller is able to, our breast health nurse navigator, she gets me in touch with those women, and I'm able to get them in here before their surgery so we can meet, kind of answer some of those unknowns that they probably have going into surgery, which helps ease some of that anxiety.
That's really good to know. So you actually meet them prior to their surgery. So you just don't.
A few days or a week or so. I mean, different time frames, but
then they don't wake up from surgery so afraid because they've already been told what to expect. Okay.
What do I do now? You know, so. And it's a lot easier to pre-fit them and have their proper or their correct sizes when they're not in a hospital bed and have IVs hooked up to them, you know. So yeah, we do there's a couple different style garments that I bring, and they first provide drainage management for their drain bulbs. And then they also give them something temporary to wear to help restore that natural silhouette while they're healing until they can advance to the more permanent style external breast prostheses and then the mastectomy bras.
Right. Well, I'm certain by the time that they get to you, Mary Miller, who is wonderful, as we just previously met her, has probably talked to them about the fact that they will have some drainage bags, because when I hear you say drainage, and for our viewers that aren't aware or haven't known somebody immediately after the surgery, there are drainage bags, but it's minimal. It's only for, a couple weeks?
Yeah, usually. I mean, a lot of times if they've got a couple immediately after surgery, a lot of times they'll have one of them removed before they even go home, and then they'll usually have the one for a week or so.
Sure. So at least they're aware of that, they're educated on that, and then they get to see you and get to see how these undergarments fit and what the purpose of them, and help them feel natural, and kind of cuts down on the shock and it's such a sad thing and hard thing to go through, but this way they're prepared and educated.
Yeah.
Well, that's good. Thank you so much, Sarah.
Thank you very much.
Serving the Fruitport area for over 40 years, Grover Pharmacy offers a full line of vitamins, supplements, and homeopathic medicines, as well as a variety of glucometers, blood pressure kits, baby care items, bandages, and wound care products. They carry office and school supplies, Russell Stover candies, promotional and seasonal items, and Hallmark cards and gifts. Grover Pharmacy, they take time to care about you.
Exhaust Specialties, from trucks and cars to street rods and Model Ts, both foreign and domestic. Exhaust Specialties now includes brakes, shocks, suspension work, and minor engine repair. They use only heavy gauge stainless and aluminum pipe. They also feature custom tools as well as a selection of lubes, oils, and filters, and other auto parts. Exhaust Specialties located at 5401 Apple Avenue in Muskegon.
Beginning as a lumber company in 1911, Fredericks Construction has been servicing the Muskegon area since 1969. Family owned and operated, they specialize in roofing, siding, windows, insulation, additions, doors, decks, and more. Located at 1940 Commerce Street in beautiful downtown Muskegon, their phone number is 231-722-3937. When you want quality workmanship, you want Fredericks Construction.
Thank you, West Michigan, for watching Alive and Well. You have been with us at the Mercy Health Comprehensive Breast Center. And if you need to schedule a mammogram, or if you want to know some more issues about breast health, first of all, you can visit mercyhealth.com, or you may call to schedule. If you are uninsured or underinsured, call 231-724-7298. Or if you need further information, to schedule a mammogram, you can call 231-672-4800. Again, if you want to schedule a mammogram, 231-672-4800. Thank you.